Welcome to our podcast, proudly sponsored by Victoria Park Medispas, recognized as Canada's top Medispa. With 23 premier locations across 3 provinces, Victoria Park Medispa is dedicated to providing you with industry-leading expertise and the most comprehensive array of treatments tailored to your unique needs.
I think injectables get a bad rep just because what we notice is maybe something that's not our style or that's a little bit overdone. And once again, not here to judge. To each their own. Everybody has their own styles. If you want bigger cheeks, bigger lips, whatever, you can get them. But we're just not going to notice what's well done and well proportioned because people are going to think you're natural. That's how injectables should be, indetectable.
Oh, an extraordinary.
Hi, everyone, and welcome to this episode of Owning Extraordinary. I'm very happy to be with you two today.
Thanks.
It's a podcast by Victoria Park Medispa, and we're here with Karine today.
Hello.
And Anabel, and I'm Shadi.
Hi.
Thanks for having me.
Our
Thank
pleasure.
you for being here.
Thank you so much, Annabelle, for being with us today. We're here to discuss biostimulators. So it's a huge trend in medical aesthetics, and I'm sure not a lot of people know what that means, and you're here to tell us all about it. So thank you again for being here.
Thanks
So
for having
some
me.
might have an idea of what biostimulators are. We actually touched a little bit on that with Dr. Scott Nicky during our last podcast, and it was very interesting. But
Yeah.
I'm very happy we had Annabelle today because
Yeah.
we're going to talk about it more in depth. And we're going to debunk this medical jargon with Annabelle today.
Yeah, so just to give you the introduction that you deserve. So Annabelle is known for her transparency and relatability on social media. We'll put her handle in the show notes. In regards to medical aesthetics, what truly makes her stand out from other injectors is her ability to build that genuine connections with her clients, making them feel instantly at ease as if they're chatting with a trusted friend, which is what I feel like we're doing here today. So tell us a little bit more about you, your journey in medical aesthetics. How did you land here?
Okay, so basically went back to school a little bit later in life. Chose nursing just because it's very vast. It's a very vast field. You can do a lot of different things. Did a bachelor's degree in nursing science in intensive care. Which I never used, and then worked in Sacré-Cœur in internal medicine for 4 years. Aesthetic has always been something that I was interested in. Basically, got an opportunity to be mentored for a couple of years by somebody who was doing this for over 15 years in Sherbrooke, which was a great learning opportunity. And then one thing led to another. I just basically had another opportunity in Montreal, which led me to build an amazing clientele here on the island. Then COVID hit, and basically I had to choose between hospital and the aesthetic world, and it was a no-brainer for me. So once I did my first patient, I was hooked, basically.
I actually forgot to mention that you're in our old Montreal clinic.
I am.
Which is I think one of our most beautiful clinics.
Yeah.
It's newly renovated. Highly encourage you to go and see it. It always smells delicious in Montreal.
I mean, it's still Montreal. I think it's very Scandinavian, very like, you'll feel welcome when you get in the clinic. People are happy to be there, and our whole team is just very friendly. I feel like that's
amazing.
I think that's our best asset as a team, and we're very all close together. So
Yeah, that's right. Yeah. Great. Well, thank you for that introduction.
So, Annabelle, what I think is amazing is, you've been injecting now for quite some time, but what you are standing out for is that you've become such a trusted voice online. You created so much education around injections, and a lot of people, follow you for that because you're so honest and you're so true. And so why did you decide to show and to share all this information with everybody?
So basically, when I opened my Instagram a year and a half ago, it was to create some information that's digestible for people. I also wanted to democratize injectables. I feel like they have a bad rep just because everybody's talking about their personal experiences online. That's very biased. I feel like if you want to have the right information, because there's so much information out there, I feel like people can look at my stuff and just, have proper non-biased information where you'll have information on the molecule or the treatment. We can never really compare ourselves to anybody like online. So I feel like I created this platform just to inform people basically.
Yeah.
And truth be told, it's my worst nightmare to film myself.
Yeah. doesn't look like it.
I know
Yeah.
everybody says so, but I do it for my patients. I do it for the population, just for proper information. It takes a lot of time.
Yeah.
It takes a lot of
No, for sure.
patience.
Yeah.
But it's just to have, real proper information, because you can get lost with
Right.
everything that's out there. So.
Yeah, I'm sure you recruit a lot of new clients with that genuine approach and that sort of no-nonsense approach. When they do come and see you, what are they worried about at first? Like what's their first concern when they come and see you and they say, I want to look a certain way, I want to feel a certain way, but I'm worried about X, Y, and Z.
Yeah.
What are you seeing?
So one of the first things I've noticed over the years is how negative people talk about themselves, which is my worst nightmare. So if you know, if you're my patient, no negative self-talk in my office. I'm trying to put everybody's best features forward. So I'm trying to teach also people to love their best features. But okay, so basically to answer your question, I feel like people are going to come in for to look less tired, to look more like themselves. Most of my clientele is between 45 and 65. So there's menopause included in that. So people feel like the image they promote is not how they feel inside. So they just want to connect these two. So looking sad, tired, they just want to look fresh. They just want to look revived. They just want to look happy.
And you talked about the bad rep of injections, and I think we can all remember those. And I mean, everybody has their own style, and we're not here to judge, obviously. But maybe 20 years ago we had those pillow face, and I'm sure everybody can look online what it means, and we have some content about pillow face on our social media. What I think is very interesting is that now we're going more and more towards natural beauty, and we still have that bad rep. This platforms also help with that. So what do you see patients coming in for? Do they know what they want, or do they just tell you basically how they want to feel? Do you see that they're more, they want more of that product or this type of procedure? What do you see the trend going in?
Okay, so basically if people come and see me, they've done their research, they know my style, they know they're not gonna look transformed. I think injectables get a bad rep just because what we notice is maybe something that's not our style or that's a little bit overdone. And once again, not here to judge, to each their own. Everybody has their own styles. If you want bigger cheeks, bigger lips, whatever, you can get them. But we're just not going to notice what's well done and well proportioned, because people are going to think you're natural. That's how injectables should be, indetectable. I feel like now the trends are more towards real
results,
real regenerative medicine. I feel like people are looking forward more to biostimulators, which we can talk a little bit more about. But yes, very natural, very we want to go along the aging process. We're not going to stop it. So let's just ride the wave and go along with it. It's going to look better in the end anyways. So.
Yeah, I think what I'm seeing in my circle of friends anyways is people who were adamantly against injectables and maybe it's an age thing because I'm nearing that 45.
40s, yeah.
Yeah,
The 40s.
they were adamantly against injectables as a principle, out of fear maybe or whichever. But now because of new technology, they're more attracted to it because it can be more natural, because it can be not just fillers. Maybe back in the day we had Botox and fillers and that was it. And now there's a lot more gray zone. And so are you seeing that in your practice where people are coming in and saying, I don't want the traditional injectables, I want other things?
Yeah. I do see that. I do see kind of an anti-filler movement. Yeah. I love to tell people that I have a lot of filler in my face just because, over the years, probably like 15, 20 syringes of filler in my face, just to show them that you're not going to look crazy when it's the right product. The thing is, people come in, they think they know what they need, but they're also here to be for a consult, and they're also here to be told what they do need. So let's just take an example. Let's say people want to do Sculptra only because they don't want filler in their face, but if they lack a lot of volume, they're still going to need the filler. So you need to be explaining to people what they need, what's the proper treatment plan for them, and that's the whole point. So you need the proper treatment plan for the best result in the long run. So I'm always going to respect what people want if they really do not want filler, but they need to be well informed because once again, what you see online is you have to be careful.
Well, I doubt that somebody would not listen to you as a professional in the field and say, sure you can get the following things, but then if you don't get I know with for instance, biostimulators, often if you're recreating collagen, you can have what we call like the peanut head, which, is hollowed temples. And so you wouldn't need fillers for that. So who would say no? But what I think is happening is there's such a negative trend around fillers that they're going in without actually understanding the role of fillers. It's more of a principle than it is an educated, stance on what they need and don't need.
Yeah, and also I can understand in seeing all of the things that can seem very extreme with filler. People think with one syringe you're going to look crazy, which absolutely not. And that's why you go to a trusted professional.
100%. Actually, just a little anecdote. So when I started at Vic Park 6 years ago, because I was not in a medical aesthetics field previously, people very close to me thought I was getting my lips injected, and my son has my exact lips, and I was like, do you think I'm also injecting him? At the age of 6. But it was really crazy how people equated, and like the judgment of using fillers. And I was like, no, these are my lips. Not that there's anything wrong with getting your lips injected. And since then, I actually had a bit of smoker lines, which is a medical definition. I don't actually smoke, but I had a little, because I got older. And so I did refill sort of like the lines. But I thought that assessment or the jumping to conclusions was so interesting as like a societal phenomenon of like, oh, you now get your lips injected, as if like I've been caught. And, it was very interesting.
And it's also very funny because most of the time my patients have their lips injected and they tell their friends and they're like, no way. So, I mean, everybody says when you get your lips done, it always shows. Once again, that's not true. So
okay, my apologies. We went off topic.
So we have pretty much three categories of injectables. We have toxins, we have fillers, and then we have biostimulators, right?
Exactly.
Just to make it more digestible.
Toxins being
Botox,
right?
Dysport,
Nuceiva,
right?
Yeah.
So can you quickly explain, really quickly, what is toxins, what is fillers, and then we'll dive into biostimulators.
Yeah. So just to make it clearer for everybody, I'm just going to tell you what they do.
Yeah.
Instead of explaining what they actually chemically do or whatever. So toxin, aka Botox, Dysport, all these brands, they're going to work towards making the texture of your skin better. So basically wrinkles, but also hyperhidrosis, bruxism. So they're going to relax your muscle. It can help with opening the eye area, looking more refreshed. But basically, it's to maintain the texture of your skin, reduce wrinkles.
Right.
That's toxin.
It doesn't add or reduce any volume on the skin.
No volume.
Exactly.
No
Right.
volume at all. Just to make it simple for people, usually upper face. Okay. When we're talking fillers, so hyaluronic acid basically replace volume. So as we age, we're going to lose fat pads in the face. Some people have different genetics. Some people have more hollow under eye,
Temples.
temples,
right.
a receding chin, which is very common in Quebecois. I mean, it's
Is that really a Quebecois thing?
well, it's very common in Quebecois
I had no
to have a
idea.
receding chin. Yeah, actually, yeah.
Wow.
So basically, it's not
Exhibit
an,
A.
it's not an age thing as when you're going to use fillers, but it's mostly your physiognomy and just replace volume.
Right.
It doesn't mean give volume, replace volume. Okay. Biostimulators can work on the firmness of your skin. It's going to work on building your own collagen. As soon as you're talking biostimulators, we're talking building your own collagen, which we're losing very rapidly after the age of 25. Every year, we're losing more and more and more. And when a menopause hit, it's getting even worse.
25%
Per year.
By the age of 45.
Something like that.
Yeah.
I think it differs from.
Yes, of
Yeah,
course.
so-
I mean,
yeah.
genetics, lifestyle.
Yeah.
Are you in the sun?
Yeah.
Do you have proper skincare? Do you
work-
do treatments?
Do workouts also impact?
I feel like having a proper life regimen, like taking care of yourself, is a whole, like, it's going to be
beneficial
all around. So if you're eating well, you're working out, your muscle mass and your bone density is going to be better everywhere. And it's just, you can take care of your face. You need to take care of your body as well. You know, everything else, you have treatments. Yes. But I mean, you know, take care of yourself as a whole. So, so basically biostimulators, let's just talk firmness of the skin.
Right.
Yeah.
So if I want to explain this to at coffee table with my friends, I would say biostimulant is basically for you to look almost the same as you were 5 years ago without changing any features on your face and just aging gracefully and making your skin look nicer.
Yeah, basically. But the thing is, I also use it in a couple of different ways depending on what I see. Right. And age and where are we at in the treatment plan. So let's say I have a 30-year-old coming in. She doesn't want filler. She doesn't need filler. She wants to maintain everything in place. We can do a preventative scalp drop. In their 40s, the patient's probably going to need some volume replacement. Probably. It really depends. We're going to start with fillers. We're going to replace some volume, and then we're going to maintain with Sculptra to keep everything in place. So better matrix, better support for the filler, the existing filler.
Yep.
We're going to put less filler in the future. Overall, you're going to look much better long term, and your skin's going to have the firmness that you want, because we all know when we get closer or we're in our 40s,
right,
it's the skin that's changing. So we need to work on that as well. You can fill, you can freeze, but you need to work on the skin quality as well. So that's where biostimulators will step in.
And there's no one size fits all, of course, but would you say, let's say you want to start a journey like 2030s, would you start with biostimulators? Would you start with toxins? Like what would be, let's say, a perfect cocktail, and for what age?
Okay. Well, for me, 20-year-olds, I rarely say yes to anything. I'm like, my patients, I see them as my family. Like younger patients, I see them like I have 3 sisters. So I see them as my younger sisters. And I'm like, you don't need anything. Well, I'm going to, of course, assess them and see like if it's necessary. But when it's not, It's
Right.
not.
Yeah.
Come back close to your 30s when you have some lines that we're starting to see at rest. We'll talk. I feel like it's mostly taking care of your skin, okay, in the 20s.
Right.
Microneedling, proper facials, proper skincare. Protect your skin at all costs. Vitamin C, sunscreen. End of the 20s, preventative Botox.
Is it what you call baby Botox?
Baby Botox, which is underdosed Botox, which is like, we're just going to maintain your skin. We're not going to do anything crazy. In the 30s, then we're starting to see the muscle mass, the fat mass is going to change in the face, mostly in the middle cheek here. So you're going to look a little bit more tired. So we're going to work with fillers. And fillers is also just a game of light and shadow. It's like makeup. So you work with the light to put the light in the proper places in the face where it should hit, so the apex of the cheeks and stuff like that, just so that you look fresher, that the light hits at the right place. Because if you're hollow in the mid-face, you're going to look way more tired. So support the ligament here. We're going to replace a little bit of volume here and there, And then once again, skincare, lasers, work on protecting your skin. Then 40s come, and then we're going to introduce the biostimulators. But I feel like doing a little bit of everything will make a lot of sense. Am I going to do Sculptra on a 20-year-old? Not really.
Yeah.
She's still producing a lot of
Collagen.
She or he is still producing a lot of collagen. In your 30s, it's starting to change. If the patient doesn't want filler, I could do biostimulators to prevent, to keep everything in place. I'm going to do less treatments, less bios. I customize my treatments to all my patients. So no cookie cutter approach for me. Everybody's very different. We're going to look at the results they want to achieve. And my only goal, I'm thinking 10 years forward. So I'm thinking we're going to do small tweaks. We're going to work slowly. And we're going to get there, and we're going to just maintain and just, like I said, ride the wave. But usually, a little bit of Botox, a little bit of filler,
A little bit.
a little bit of biostimulation, lasers in the mix, and skincare, of course.
Basically, come see us.
Yeah. Come and see me.
So I want to, excuse me. I want to dig a little bit deeper in biostimulators.
Yeah.
So it's relatively new trend, but it's been around
for a long time.
for a long time.
Yeah.
So tell us about biostimulators. How do they work? Are there different brands? You've explained how you would use them, but they build collagen.
Yeah.
So how do they do that? Explain to us how they do that.
I don't want to get into the whole chemical things because they do, like, let's say we have two right now in Canada. We have Sculptra and we have Radies.
Yeah.
They work differently. I would use them differently, and I can elaborate on that. The Sculptra I would basically use a little bit more on the face, just because I've worked with different people who taught me some techniques to really customize the treatments with dilution and whatever. So I use it more on the face and neck. For body, I would use mostly Radies. Radies is a completely different texture.
Okay.
So Sculptra is a powder that you mix with water.
Okay.
So it's liquid
Okay.
when you use it.
Yeah.
Radies is like white toothpaste.
Okay.
And it has a very high G prime, so you can use it as is and work on structuring the face, really like building like a chin, a jawline, cheeks, and stuff like that. Or you can really dilute it to your liking and use it more superficially on crepiness of the skin. So it's very versatile. It's really good for body, let's say inside the arms, top of the knees, décolleté. But you can use it also in the face. I just have my personal preference. I love them both for different things.
Okay. So Sculptra creates collagen. We talked
They
earlier.
both do, yeah.
They both do.
Yeah.
How long do the effect? So how long does it take to come into effect, and how long does it last?
Okay, good question. So basically, Sculptra, like for a collagen cell to be created, it takes 30 to 90 days.
Okay.
So let's say I do a treatment of Sculptra the day of, do I see results? Basically, short answer, yes. Just because it's mixed with water. So it's like I just injected six syringes of filler in your face. You look awesome. You're like, ooh, I love it. I tell my patients, listen, it's mixed with water. You're going to absorb the water.
Yeah.
3 days, it's like I've done nothing. And then in a month, 30 days, the magic starts to happen. So you're going to see the Sculptra glow. You're going to see your face is like brighter because once you have a collagen production, your skin looks better. And then you're going to start to see a little bit of more firmness and some changes. It's very subtle. And most of the time, I have to take pictures to show people. But most people just tell me, when I wash my face, I can feel my skin feels different. So 30 to 90 days, oppositely to Radiesse, where you're going to see more results right away because you still have that gel that's there. So the Radiesse is going to have a filling effect right away, but then you're going to metabolize the gel a little bit further down the line and your collagen is going to replace it.
Okay.
So they work very differently. I mean, people have their own protocols and it depends on what you need as a patient. So.
Okay.
We talked earlier about patients knowing what they don't want, like I don't want fillers or I don't want this. And then you have patients that know what they want sometimes a little too much.
Yeah.
What do you think the level of information and education should be when you go see a professional? And just because you don't want somebody to not know anything, but you also don't want them to tell you, oh, I want 1 cc of this or that, etc.
Yeah.
So what do you think the good balance is, and where should people get their information? How should they be educated?
I mean, I think we all have this patient who comes in and is going to direct the consultation. I think it's I think when you're a confident injector, you have to tell the person, listen, this is my expertise. I understand you think you know what you want, but this is not like you're not trained for this. Maybe you read online that this product is better than another, but maybe not for you. So I explain to people, it's like when you do your taxes, basically. When you go see someone, you trust them. When you go see your taxes, you don't count after your accountant.
Yeah.
You trust them.
Yeah, of course.
And then so, yeah. And it's the same with results. I mean, you're not going to get the same tax return as your friend. So you're not getting the same units as your friend. So basically, I think if you find an injector in which you trust this injector, you've done your research, arrive with an open mind.
Yeah.
I think there's different types of personalities who are stressed, who are nervous, and are trying to direct the consultation. But when you're a seasoned injector, it's not going to go that way. You're just going to be like, listen, let's start over. I'm going to assess you. I'm going to tell you what you need. If you're comfortable with that, then let's work together. Because let's be real, the patients choose us, but we also choose our patients.
Of course.
If we see that the vision is not, we cannot work together long term.
Yeah.
If the vision of beauty is not the same, it's not worth even trying, just because I'm always going to say no and you're always going to want more.
Yeah.
So the vision needs to be aligned. So basically, if it's a fit, it's a fit, and the trust is going to install itself. Of course, at first, you need to ease into it. But I feel like when you go see an injector, yes, you've learned a lot of stuff online. It's cool. It's nice. But if you trust that person, just...
Yeah, and you have all level of information online, right? You have
Yeah.
the good, the bad, and everything else. So
Yeah, mostly the wrong information as well.
Yeah.
So you have a lot of anti-injection people who don't tell you half of the story. So we've all seen that story where the girl had an eyebrow like this and then a ptosis like this. And then, as somebody talked about, aftercare.
Yeah.
Like, did she go do a hot yoga class right after? We don't know that.
Yeah.
So basically, it's easy to judge and be like, first of all, it would have been fixable.
Yeah.
That's the first thing. And then it's easy to judge when we have half the information. So go see a trusted professional and just follow what they say. And if it's a fit, then you should get great results.
Yeah.
Can you tell us a little bit about the education of how do you get into injections? I'm sure a lot of people want to know, like, do you go through a special education path? How does that work?
Okay, so basically to be an injector, you have to be a nurse or a doctor. I know that now it's new, but dentists can also do a couple of things.
Yeah.
Basically, you have to go through injectable class. And then the thing is most people are like, how did you get into it? How was it? My advice would be go to a proper training school. It's usually 3 days. 3 days is very short. If you don't practice or start right away after, you're going to forget everything. So it's a big investment as well.
So anyone can become an injector if you're a nurse or a doctor.
Yeah.
After 3-day training.
After 3-day training. The thing is, if you do have your permit, if you care about your permit, you're going to be very careful with what you do with that 3-day training.
Okay.
And you're going to pay for more training, and you're going to get some mentorship where you can go shadow people and just get your experience, because you're not good when you start and you don't even know how to evaluate a patient and you don't really know what they need. So 3 days is really, really, really fast. I think it's your job, it's your duty as a medical professional to do continuing education.
Yeah.
And you become a good injector when you do this every day
Yeah.
for a long time. See different faces. So you need experience. You need to be properly trained. And I feel like if you're not comfortable after 3 days, which you shouldn't be, you should take more training and go to more conferences and go see live injections. And
Well, that's really one of the things that sets Vic Park apart is the fact that we are a network of injectors, of doctors across and nurse injectors across the network that are very experienced. Some of them have very specific qualifications in a specific field. And we share that knowledge. We have something called Vic Park U, Vic Park University. And you as an injector also get access to those trainings, right?
Exactly. Yeah. So we do have a lot of very experienced doctors or nurses that will do training all around Montreal. We do have a lot of training. We also like the pharmaceuticals company do set us up with a lot of training if we need them. So, you can always reach out to your rep and they're going to organize a lot of things. And even during, the fall, it's a little crazy. We have to choose because we would be there every day. We would have training every day. Yeah. So we're very lucky to have very seasoned people to train us for free. You just need to attend those training basically. So.
Yeah, you're going to one very soon, right?
Actually, I am going to Medellin in October. So Vic Park's sending me to a conference in Central America. I'm very excited.
That's very cool.
Wow.
Yeah, so we're
all going.
Yeah. Colombia has always been very advanced. Yeah, very advanced in the medical aesthetics and surgery and everything. So I'm going to get some little perks there.
Not that Colombian women need it.
No, they're so
beautiful.
Pretty. Yeah, exactly.
And we have our own national conference now once a year with all the doctors, all the nurses, where we share some knowledge and there's some live injections and it's a lot of fun too.
Yeah. Yeah, no, it's definitely a big perk because I always think how are new injectors supposed to start in the field? Like for them,
I mean, it's hard. You need to have someone who's willing to coach you through the transition of being a beginner and then the learning curve, which is a little steep.
Yeah.
And then building a clientele is not easy. There's a lot of there's a lot of competition out there.
Yeah.
And I feel like when you're very passionate about it, it'll always work.
Yeah.
I think when you love your work and you love people, it's always going to work out for you. The thing is, you need someone to be there to answer your questions, to be available. And that can be a little bit difficult. In my time, it was not easy to even just have proper, there were a lot less clinics. Now there's a lot more doctors doing this. There's a lot of doctors getting trained every day. So basically just have a good mentor. Yeah.
Yeah.
All right. So now we're going to play a game because we love games. So we're going to call this game overrated or underrated.
Okay.
Not that it needs any explanation. So I'm going to give you those buzzwords and you're going to tell me if you think they're overrated or obviously underrated. Facial harmonization.
Underrated.
Skin tightening in a syringe.
In one syringe?
In one syringe.
Skin tightening in a syringe. I'm going to have to say overrated.
Okay. Preventative injections.
Underrated.
Underrated, for sure. Profile balancing.
Underrated.
Yeah. Liquid facelift.
Overrated.
One syringe transformation.
Overrated.
Yeah.
Obsessing over asymmetry.
Overrated.
Rejuvenation.
Underrated.
And glass skin.
Overrated.
Overrated.
Yeah. Overrated. Yeah.
Yeah. What is skin tightening in a syringe?
Okay, so basically, working on the firmness of the skin with Sculptra and everything, I just feel like it's a little too simple. Like people are really gonna think with one syringe, we're gonna give them the facelift effect.
Yeah.
So let's just not go there.
Yeah.
And can we also, I think it's important from what we said before, it's very important to have a combination treatment, as you mentioned.
Combination.
So you could have an injector like yourself saying you need Botox and fillers and a biostimulator at the same time.
Yeah.
It doesn't mean it's going to be crazy amounts, but it's just your face requires it. And so, one syringe usually doesn't fix.
No, and also people think, it's important to understand that you have to treat your face as a whole. Yeah. So you can do Botox for years in your upper face, but then your lower face is not going to match. Yeah. So you need to be careful about wanting to do just one thing and being comfortable with just one thing because it's just not going to look good in the long run. So.
If you do that cocktail that we were referring to, do you get to do less in the long run if you've done it properly along the way?
Yeah. So basically people who start very late in the game, we're going to have to do so much to come back to like a kind of a baseline where the volume is restored, the skin has been repaired, the wrinkles are a little bit less. And some people, it's like at some point, if there's too much damage, it's not that we can always do something. Mm-hmm. You just have to be realistic about the expectations.
I also mean like if you do a little bit of filler.
Yeah.
Does that mean
it can be preventative?
Does that mean that you do a little bit less Botox? If you add biostimulators, does that mean that you're doing a little bit less filler in the long run?
Okay, so Botox, fillers, really different things, different areas. But biostimulators though. So if you do a little bit of Botox, are you going to do less fillers? Maybe in the lower face. Maybe. If you do a little bit of filler, are you going to do less tox? Not really.
Okay.
If you do a little bit of biostimulators, are you going to do less fillers? Definitely.
Okay.
In the long run.
In the long run. Okay. I know that one thing, back to biostimulators for a second, I know that one thing that people are afraid about with filler specifically, because of social media, maybe misinformation, is that it stays forever. ever
Yeah.
in your skin. And
Yeah.
they, they've done autopsies on corpses and they saw fillers
Mm-hmm.
there. Number one, is that true? And number two, do we get that with Sculptra?
Okay, so fillers will last way longer than we thought. That's true. At the same time, a well-placed filler will not disrupt anything in your face. So you paid for it, it stays there longer. Win-win. Okay. A misplaced filler, I find, will last a little bit longer. We tend to see this in the tear trough area. They used other techniques back in the days. Now we do have filler that's specifically made for different areas of the face, like tear trough, for example. They draw less water. Are you a good candidate? Should you get surgery?
Yeah.
That's all important things to take into consideration. The thing is, the filler does stay longer, but it's not necessarily a bad thing. That's my answer to that.
Back to like the tear trough story and everything.
Yeah.
Back to like an experienced injector.
Yeah.
Other questions you should ask a potential injector is, which products do you use? And if they only answer 2 products, you're in trouble.
Yeah.
Because the products really can vary in terms of their effect, right?
They do. You cannot
experience also has to do with your comfort level of using all these different products in different areas of the face. If you call somebody and all they use is Botox and Juvederm, yeah.
Exactly. But it's also technique and experience. I mean, if your patient needs surgery and you do inject the tear trough with filler, it's going to look bad. Maybe not today, but at some point.
Yeah.
You have to tell the truth. There's a limit to what we can do with the non-invasive technologies that we use in our offices. Refer to a surgeon when the candidate is not does not have the anatomy for filler.
Which is great at Vic Park, once again, because we do have plastic surgeons.
Exactly.
And so we wouldn't keep you as an injectable client if we felt like you were a surgery client.
Yeah.
Because,
they
we also
trust you.
have-
Your
but we
patient
also
trusts
have
you
it-
to tell them when they are in need of surgery. To come back to your question, Sculptra is going to be your own collagen production. So you can see a little bit of collagen formation. You can see a little bit of comment je pourrais dire ça?
Deposits of collagen.
Maybe accumulation of collagen. I've had a lot of things with I have a lot of questions with Sculptra as well. So people have been telling me, I've heard about nodules and everything. When Sculptra was brought up in the industry, it was in the 70s for HIV patients. And they used to inject very concentrated Sculptra just in one spot.
Why?
Well, because it was from lipodystrophy, from the medication for HIV. Basically, they used to inject it like that, no massage, no nothing. So it did create nodules.
Okay.
Because that's what it was injected in just one spot.
Okay.
So when properly used, any product will be very beneficial. You just have to be conscientious that you're still injecting something into your face. Aftercare is very important.
Yeah. 555.
Sculptra needs to be massaged
5 times
days,
a day.
5 times a day, 5 minutes for 5 days.
Yeah.
And then if you don't do that properly, I've never had nodules, knock on wood, in the last years of doing a lot of Sculptra.
Yeah.
I mean, when the aftercare is properly done for filler, for anything, you should definitely get amazing results.
So just really quickly, from my own understanding, is when you inject Sculptra, are you depositing a product of any sort, or you're depositing something that will stimulate your own collagen? Are you inserting anything?
Yeah. So it's L-polylactic acid. It's a suspension. Like I said, it's a powder that's mixed with water. So that's why you need to massage it, because the little deposits will go down in your derm. So you need to massage it so that it's properly diffused. And it's also going to create a collagen production from the bone to the top of your skin, which nothing else does that. But yeah, we do deposit a molecule. Then your body is going to have like a reaction to it, and it's going to create some collagen, basically.
That's its reaction.
Yeah.
to this molecule.
Yes.
It's like a defense mechanism, but in
Kind
the form
of.
of collagen.
Exactly.
We love that.
Yeah, we love it.
that.
I love skincare. We know that retinoids and vitamin C are the two ingredients with peptide actually to stimulate the production of collagen.
Yeah.
Do you recommend this to all your patients?
Yeah. So basically, when I see them for the first time, I'm also going to ask them about skincare just because you can get treatments done. Okay. Getting treatments done is like going to the dentist. But do you brush your teeth every day?
Mm-hmm.
Yes. Maintaining your results with skincare is so important. Like if I could insert my before picture of my melasma and my skin when I was like 29, I'm 38 now, you'd be very surprised. When I show my patients, they're like, whoa, okay. So protect, repair is like the base of skincare. If you don't want to do a 20 step routine because it gets expensive, I get it. Protect your skin, vitamin C, sunscreen, of course, hydration, of course, wash your face. And then at night, repair with retinol. That's super easy. Super easy. Everybody can do that. And that's how I introduce people to skincare. And once they see the results, usually they understand the importance of taking care of skin.
And we talked about genetics a little bit before, how, lifestyle has now shown, like we've seen that lifestyle is more important than genetics with epigenetics. I think 20 years ago, we used to say 80% of how you age is due to your genes and 20% with lifestyle. And now it's reversed back. It's 80% due to your lifestyle. So I guess, skincare, a good food regimen and all this is really important for the longevity of your skin and of your body. So
absolutely.
Holistic approach and all that.
For sure. And also most people think that skin is the first thing that people look at to determine your age. Mm-hmm. So the studies show that if we take care better of your skin, people are gonna think you're younger. Mm-hmm. So first thing that people look at to just, analyze you and assess. Be like, how old is she? How old is she? It's going to be your skin. Mm-hmm. So better. And especially take care
here, also the neck area. I know that we sometimes overlook that area, but we can inject also.
Of course.
Yeah. Don't just inject here.
Yeah. Also, take care of everything.
Take care of everything. Yeah.
Sure.
For sure. Well, we actually did the game that we played with you with the injection cocktail. We did the same thing in our other podcast with Dr. Scott Nicky per age group on like what she recommends for skincare. Mm-hmm. So we should do that in every podcast. We'll do a per age group. Okay, let's play another game.
Great.
It's called This or That. Mm-hmm. There's no explanation needed.
Okay.
You just have to,
I don't elaborate.
I think we have very, very simple games.
Very simple games.
Okay.
So tell me what you would choose between, well, I think you've already answered this question, but Sculptra and Radiesse. It really depends.
I'll go with my Sculptra.
Okay. Prejuvenation in your 30s or restoration in your 50s?
Prejuvenation in 30s, for sure.
Full face approach or treat as you go?
Full face.
Texture improvement or volume restoration? It's a tough one.
I mean, it really depends.
Yeah.
Going along skincare, I'll go with texture.
Okay.
Yeah.
Patients who know what they want or those who say do whatever you think is right?
My favorite is carte blanche.
I think hairdressers have that too, right?
So basically when people come in and they're like, I trust you, I'm like, yes.
Okay, but then do you tell them
like this though?
Yes, for sure.
More and more.
But then do you tell them like, oh my God, your nose is crooked? Like, how far do you go?
No, basically I'll tell them like an objective evaluation. I ask them first what they're here for, and then I go. Okay. And then I'm like, okay, do you want to know what I think? And then this is going to be a no, you don't need this. And then I'm like, what I would do is this, and here is why.
Yeah.
So I'm just not, it's not like, I'm not saying this is what I find pretty.
Yeah.
It's like profile, proportions.
Yeah.
I think that would look good. If you're not open to it right now, we can discuss it down the road. And at one point, we do everything I planned for, but that's down the road. Yeah.
They think it's their idea.
Yeah.
I wonder, where do men sit in that?
Men are great. Men, they come in. First of all, they trust you 100%.
Okay.
They're like, I don't know anything about that. How much does it cost? Okay, let's go.
Do they tell you my partner sent me?
It's always it's always my patient's husband. Actually, my patients are like sending them to me. So yeah,
They're just like,
most of them.
What am I doing here again?
Yeah, they're like, I don't know. My girlfriend sent me, and I'm like, great, have a seat.
That's amazing. Okay, last one. Treating the temples or skipping them altogether?
Treating the temples.
I feel like the temples are like very underrated.
Yes.
They are, because they're a very advanced area.
Oh, why?
So, well, because they can be tricky.
Okay.
So you have to be an advanced injector to do this. You have to be really well trained. They also need a lot of product.
Oh, yeah.
So yeah, some temples are hollow. So you might need 2 syringes per side over 2 sessions. It's a lot of money.
Yeah.
But they are very beneficial just because they're one of the first compartments to lift everything. They can also support the droopy eyelid and everything. And it's just a hollow temple will make you look older.
Yeah. I feel like if you were to tell your client like, oh, I'm going to treat your temples, they're going to be like, what?
They've never noticed.
They've never noticed.
They'd never noticed, but it's just sometimes it's the first step to really make everything less angly and less shadows. And so
Is that also a Quebecer thing? Because
No.
Okay, just me.
I was gonna say actually the chin too. I think it's good that we
Yeah.
talk about like underrated zone. Just the chin makes such a huge
Oh,
difference.
yes. Yeah.
And it's very subtle too.
Yeah.
But it makes a huge difference.
It
on the
does.
face. It's
does.
very, very interesting zone.
I'm very happy with my chin. It's my chin now.
And then Annabelle is looking at you and
Yeah, exactly.
It's yours now.
It's mine now. All right. So do we have any other questions?
I have a last question
Okay,
because I think we should do this now regularly. What's your favorite injection place? And I know it differs from one person to another because maybe somebody you're like, oh, I need to inject this place. But is there a specific area that you like the most?
I think my favorite injections are lower face tox, specifically DAO and chin muscle, because most people are like this all the time and it freaks me out. Just because I do it a lot, so I tox mine. So I see it a lot on people and they're like,
Never noticed.
What are you talking about?
Yeah.
What about my chin? And I'm like, you know what? I'll give you a couple units. Try it.
Yeah.
Like you notice
Notice.
pout pretty much. Like
So
people
they're
are
always smiling downwards or having a very contracted chin. And yeah, that's my pet peeve.
All right.
So I love injecting those.
Maybe we'll try.
Amazing. So I think that wraps up
Yes.
the episode on biostimulators, but just on injections in general. Is there anything on biostimulators that we didn't ask you that you want the public to know?
I think it's for most people. I think it can be beneficial in every step of the way. Just don't sleep on them.
Okay, but like literally you can sleep on them though?
You can, but
Just
I mean,
don't wait.
Just don't wait to get them done. Just don't wait to get them
Okay,
done.
but you
I was
can
like,
sleep.
Hold on. You can sleep on it?
Once you've
You
had
can.
sculpture, you can sleep again.
You can sleep.
It's over. But you look very young.
You must be upright at all times.
And actually, one last question. Sorry. Same thing for men and women for biostimulators. You would treat the same, like because it seems like the men's skin is thicker, or
It is.
Yeah, so
it's very different. I think in men, most of the time, they don't have the same needs at all. The injection points are very different. I do less men in biostimulators for sure. I think men in general have a thicker skin, a little bit heavier. So I would work more towards the back and maybe the structure. And I wouldn't mind getting them a little bit wider. As in women, we're lifting.
right.
Yeah.
So a little different approach.
Because we probably have a lot of men listening to us.
Yes, of course we
wanna
have a lot of men listening to us. Hello, men.
Hello, men.
Hi.
So thank you, Annabelle, once again for sharing your expertise
Thanks for
and
having me.
all these really brilliant nuggets of information
Yeah.
and sharing with us what we need to do.
My pleasure.
We really enjoyed this conversation. Obviously, you can follow us on Instagram at Victoria Park Medispa, and to Anabel's St-Onge Instagram too. I think you mentioned it at the beginning of the episode what your Instagram is.
We're going to put it in the show notes.
Yeah, we'll put it on the show notes. If you have any questions, comments, or anything, please let us know. We'll be happy to answer.
Absolutely.
And thank you again so much. Very exciting.
Until next time, everyone, stay curious, stay confident, and keep glowing.
This is your time.